Okay, so here's a patient of mine that had surgery 1 week ago. She's 55, she came from the United States for facial rejuvenation, and basically she wants to look younger. She's bothered by her lower eyelids, so we plan an eyelid surgery, and she's bothered by the face, and mostly by her neck, this excess tissue under the neck. So the plan for her face was a facelift / neck lift. That's going to use an incision that tucks around the hairline, around the ear, inside the ear, and then back behind the ear in natural creases. So that ends up being essentially hidden once it's done and healed. And with that, what we can do is basically lift up the skin and then lift up the muscle as a separate layer. That's called a deep plane facelift, and we do that in essentially all patients. I think that's the most powerful technique in facelifting because by lifting the muscle, you're lifting the architecture of the face and fixating it essentially where it was prior. So that's able to essentially restore someone's younger anatomy and make them look like a younger version of themselves and very natural. So everyone in our practice pretty much gets a deep plane facelift. That allows us to lift the mid-face, that restores facial volume to the cheekbone and gets rid of the nasolabial fold. It allows us to lift the jawline to get rid of jowls and to get a tight, smooth jawline, and it allows us to lift the neck. Essentially, in a patient like this with a lot of neck excess, we can bring the neck way up and back and get that neck crisp again. The other part of her procedure was facial fat grafting. And aging is caused by descent of facial structures, laxity of skin, and loss of volume. So in essentially every facelift, we add facial fat grafting so that we can lift and suspend tissues to their prior position, and we can provide fat grafting and volume to places where it will enhance the result. So in a patient like this, once we lift everything, we fill in areas that have lost volume over time, as well as areas that are youthful and full in a younger face. So in this patient, we did fat grafting nasolabial folds, marionette lines, genomental angle, infraorbital or underneath the eyes, basically to restore volume. And then we also provided volume in naturally full areas in youthful faces, like the cheekbones, the temples, and she got some in the lips as well. So she had a great procedure. It was very efficient. Took 3 hours and 50 minutes. So she woke up immediately and went right back to the recovery suites. She's had an excellent recovery so far. She's post-op day 7. So here she is. She's right in the middle of the healing process. So she's got swelling and bruising. I tell patients to expect to look strange or bizarre the first week. And then after that, it starts getting better. At a week, she's not so bad, but you can see her incision. It's still very fresh, but it's hidden around the ear, and even zooming in on it, looking for it 1 week after surgery is pretty inconspicuous. And although she's swollen and probably looking her worst as far as things are going to go, we can see the total facial structure has changed. Her volume is up and back, and look at her neck. She's got a nice, crisp, beautiful neck and a beautiful jawline at the height of swelling. So that's only going to get better as the days go by. I'm quite excited for her, and I think we're going to get a fantastic result.